Go to the SilicoFCM web page. Then you can type your credentials into the login page of the SilicoFCM platform to get access to the main dashboard page. After the successful login, you can choose the Data Analytics tool, which resides on the Tools module of the SilicoFCM platform and consists of the Risk Stratification and Disease Progression tool. In the first step, click on the Risk Stratification tool. Using this specific tool, you can download the templates for events, measurements, and medications, and populate all the fields that are required for the specific features included in the templates that are provided. Then you can upload the datasets for events, measurements, and medications, clicking on the Browser button, and then execute the workflow by clicking to Execute button. The medication and events data can be left out if no data is present for the evaluated patients. However, if there are past events and/or medications, you should follow specific guidelines that are provided. After the successful execution of a risk stratification, you are able to select patients to be visualized and visualize the outcomes through an interactive plot. For each measurement, one prediction is given. If a patient has several measurements, the latest one has to be used for the evaluation of the current risk. The next function is the Disease Progression tool. You first download the templates for events and measurements, filling out all the required corresponding fields. Then upload the datasets by clicking on the Browser button. And then on Execute button. The events can be left out if no data is present for the evaluated patients. However, if there are past events, you should follow specific guidelines that are provided. After the successful execution of disease progression models, you can select patients to be visualized and view the outcomes through an interactive plot. The explanation of the disease progression prediction is visualized in a bar plot. For each of the input attributes, a value presented in the plot corresponds to the contribution of the attribute to the change of the target value. If the correlation is positive, it denoted by the blue bars, then the current value of the attribute increases the value of the target variable. On the contrary, if the correlation is negative, denoted by the orange bars, the current value of the attribute decreases the value of the target variable. For example, the explanation for the prediction of LA volume suggests that the value should decrease due to the age of the patient and BSA, but increase due to his values of IVS, LA, and LA volume. Since the sum of bars on the right is greater than the sum of bars on the left, the value of LA volume will overall increase.